General guidance on taking measurements. Please heed the general advice on taking measurements before starting the training program. When taking measurements for lymphological treatment, you are advised to use a non-stretchable measuring tape. To be able to measure the length so that it is compatible with the circumference measurements, you should mark the individual measuring points with a water-soluble kohl pencil. In difficult cases, we recommend you use photo documentation of the measuring process. In general, the compression stocking is not measured for size till the lymphedema has already been reduced by 70% to guarantee a perfect fit. Contacting the lymphathology therapist for specific information can be very useful. Measurements are best taken as soon as the patient has got up in the morning or following manual lymphatic drainage. When taking measurements, please ensure that at certain measuring points the measuring tape is pulled tight, which means measurements are taken while stretching the tape. In the training modules, these points will be shown to you. However, avoid stretching the tape abruptly and make sure to take into account the resistance of the edema. By stretching the tape while measuring, the number of stitches is reduced, and as a result, the stocking fits tighter on the leg and can contain the edema better. The tighter the stocking, the wider the stitches are stretched when the stocking is worn, and this leads to better air circulation. The compression stocking is felt to be not as warm. Do not measure in skin folds, as this may easily result in constriction. To facilitate the measuring process, it is possible, especially in the case of patients with pronounced skin flaps or wart-like outgrowths, to take the measurements on a traditional pair of sheer tights. In this way, you will minimize the risk of inadvertently slipping into a fold with the measuring tape. To avoid discomfort for the patient, for example in the case of particular hard spots, lymph pads can be placed under the stocking. For this purpose, you should, however, consult a lymphathology therapist. A two-piece solution, for example, consisting of an arm stocking and a glove, is often more practical in everyday life. The stocking is, for example, in order to wash one's hands, taken off and put on several times during the day. If it therefore consists of single parts, the latter can be slipped on more easily, and this simplifies daily use. Please ensure when taking measurements to measure the overlapping of the upper part without stretching the measuring tape to avoid a double compression effect. For a two-piece solution in the leg area, you have to fill in two separate order forms. Your stockings must be washed every day. This is particularly important in the case of flat-knitted compression stockings because the stitches are highly stretched at all times and consequently perspiration, skin, and sebaceous matter can collect there. These dirty particles clog up the stitches and cause the stocking to slip. When washing the stockings, make sure not to use fabric softener. However, it is already often contained in liquid detergents. A suitable answer for optimal cleaning is therefore our special detergent, OFA Clean. Edema patients often have limited mobility, and that is why information on donning aids that provide support in daily life is very helpful. Our pull-on aid OFA Fit Flexi and the special rubber gloves OFA Grip not only make it possible to put on the stockings more easily, but they also protect the knitted fabric against damage. It is recommended you ask your patients after a week how they are getting on with their stockings in order to achieve a high level of therapy compliance. If you have any further questions, please contact our customer service at any time or visit us at www.ofa.de.